great conversations and education on relevant health issues management. Hello, Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Mondays 2:45 to 3 p.m. Hello, Doc. Hello, Doc.
Hello, Doc.
So I've been joined in the studios by Dr Emefa Dzide. I hope I got the name right. Yes. Good afternoon, Doc. Good afternoon. Yeah, you're welcome. How you doing? Had a good weekend? Yes. How's the day been so far? I think I can see it in your eyes, the tiredness. Anyway, so today we're going to be talking about meningitis. So let's get straight into the conversation because our time is not that much. So Doc, we want to know, what is meningitis? What exactly is it? And then what causes it as well?
So around the brain and then the spinal cord, we have this layer that covers the brain. The brain is continuous with the spinal cord. So we have a layer that covers everything up to the end. That's what we call the meninges.
Okay.
So when that is having an infection, swelling and all that, that is what we call meningitis. And usually the meninges contain some nerves, blood vessels, and then a fluid we call CSF, that's
cerebrospinal fluid.
Yes. So that is where we have the meningitis. That's if that thing is infected or inflamed.
Okay, so that connection between the brain and the spinal cord.
Covering over both the brain and the spinal cord.
Oh, okay. So we want to know, are there different types of meningitis, and if there are, what are the different types?
They can be qualified based on their causes. So with the types of meningitis, we can have bacterial meningitis, we can have viral meningitis, we can have fungal meningitis, we can have parasitic meningitis.
Okay.
And we have a very special parasitic meningitis by the amoeba, so it's called parasitic amoebic meningitis. It's separate because it has its own unique qualities and it's very, very deadly. And then we have drug-induced aseptic meningitis as well.
Sorry, drug-induced?
Yes.
You said something, I didn't get that. Aseptic,
So
okay.
you will not find
Any organism there, okay.
It's still inflamed.
Okay, but with the other ones you mentioned, they are caused by organisms. That's why the bacterial, the viral, fungal, the various organisms that causes it. Okay. So we want to know, is this something that is common or it's not too common? It's a rare disease?
It's not that rare per se, but we have what we call the meningitis belt. So in the northern part of the country, and there are seasons within which it becomes more prevalent. But it's more endemic in the northern part of the country. That doesn't mean you can't get it down south, but it's more common over there. Yeah, and the mortality rate is around 17%. Or that was about a study done about 5 years ago. The mortality rate is about 17%.
17%.
Yes.
Okay. So which people are at risk? I know you've mentioned that it's more common up north. So which people are at risk? And then also I think you can briefly touch on what makes it common up north.
Okay. So at risk, the children under 5 years are the most at risk because of the fact that they can easily progress to severe disease, and then they are more likely to die from the condition very quickly.
Is it because their immune systems are not developed enough?
Yes.
Okay.
As well as how it's transmitted and it progresses. Okay. So there's also people with weakened immune systems, like HIV, diabetes, cancer, people who have undergone transplant surgeries and are taking immunosuppressive medication. They are also at high risk. Then people living in close environment, like maybe a dormitory where there are lots of people in a closed environment, or maybe where they are staying is not well ventilated. If you've had your spleen removed, surgically removed, either from a disease or probably accident or something, you were bleeding and they had to remove it, that's also puts you at risk. Those with traumatic brain injury, traumatic spinal injury are also at a higher risk. And then some people who tend to get chronic ear infections repeatedly, they are also at a higher risk. And also people who are alcoholics, so alcohol use disorder patients, are also at a higher risk of getting the meningitis.
Okay. Let's go back a little. You mentioned the causes and then the types, but I want to know how, for example, the ones that are caused by the organisms, is it through food we eat, or how exactly do they enter that side and then cause the damage?
Mostly the bacterial and viral are droplets infection.
Okay.
So like how we get the common cold and all that. So when people cough and all that, it's in the air, it's on the surfaces. So if you touch a door handle that someone has touched and they had the droplets there, then you can pick it up. The moment you rub your eye or touch your body somewhere and it enters your system, then you've caught it. You can also get it through body fluids.
Body fluids.
Yes. So if you are sharing cutlery, sharing cups and
towels, handkerchiefs, all those things.
Yes, you can easily get it from there. The parasitic and the fungal, they are more from maybe eating contaminated food. So if like the vegetables are not washed or there's soil on it and those kind of things, then you can also pick those infections from there.
Okay, so now we want to look at some symptoms of meningitis. What would show that this might be meningitis, and then we also want to know how quickly does the disease progress.
Okay, so meningitis, the commonest 3 symptoms you get together is the fever, headache, and the neck stiffness. So the headache is very severe, and then the neck stiffness, you can't bend your head down. It's either very painful or it's just very stiff. You can't
move your head.
Yes.
Okay.
So it's very difficult to turn your head, bend your head down. Other symptoms, nausea and vomiting. There's what we call photophobia. That means sensitivity to light. So they can't stand light. So when you open the window, then they'll be wincing and shouting. Yeah. Then sometimes there's confusion and altered mental state. So maybe you realize that they are not talking very clearly. They are not making sense when they are even talking and all that. Sometimes you have extreme sleepiness or difficulty in waking up. Sometimes there's also weakness. They feel very, very weak. They are not able to get out of bed to do much. Then there is poor appetite. And then sometimes with some of the bacterial infections, you see these spots on the skin, like reddish spots on the skin. Yes. Usually you see clearer in the children.
Okay.
Yeah.
But it also affects
yes,
adults
it also
as
affects
well.
Adults, yes. But in very young children, because they can't talk, normally you have a very high fever. The temperature is very high. You see the what we call the fontanelles. You see the soft spots on the baby's head. Yes, those will be bulging.
Okay.
They'll be bulging out. Then they won't eat well. They'll be refusing to breastfeed and all that. And they also have that difficulty in waking up from sleep. When you try to wake them up, they seem very drowsy throughout the day, and also very slow, and they are not moving as much as, they are not as active as much as they used to be.
Okay. And want to know, once someone contracts the sickness and then it's not, identified quickly, it's not diagnosed quickly, how long does it take for it to progress? Even before that, let's look at the diagnosis. And then we can also look at that one too.
Okay, so diagnosis is usually from the CSF. So we have to take a sample of the CSF. Usually at the base of the spine, they would put a little needle there, and then they'll take some drops of the CSF to the lab, and then they can tell if it's a viral infection or if it's a bacterial infection or whatever. They'll be able to tell from that. Sometimes, if maybe it's an outbreak, probably you can they might use a nasal swab, how they used to test for the COVID. Yes, they can do that as well. Sometimes they may use a stool sample. Sometimes they might have to do a blood culture, or even at times maybe they'll have to do a CT scan of the brain to actually look at the brain structure, especially in cases of trauma, and also sometimes some of the parasitic infections as well.
Okay.
Yeah. As for the progression, it depends on the type of infection, and yeah, so some are acute and then some are chronic inflammation. Yeah, so chronic meningitis. But the acute ones, they usually come up within a few days to like a few 2-3 weeks. And bacterial is actually one of the fastest infections, and then they can cause severe disease within just a few days to weeks. Yeah.
Okay. So now I want to look if meningitis has any long-term effects, or if it has any complications that it comes with.
Okay, so in the short term, especially with bacterial meningitis, in the short term, if they are not managed, if they are not treated well, yes, they can go into sepsis. That's the infection goes throughout the bloodstream. Yeah, and then they can also have organ failure. Sometimes they can lose their limbs.
Organ failure.
Yes. Wow. And fingers. Through the sepsis, they can lose their fingers, and so they have to be amputated and stuff like that.
So the major thing is the sepsis, which leads to all these things.
That's in the short term.
In the short term.
The long-term effects, you can go blind, you can go deaf, you can have brain damage, so problems with your memory. You can develop epilepsy because of that. Sometimes there might be behavioral changes, learning difficulties in children especially. And then you could also develop arthritis as a long-term effect.
Interesting. Is it treatable?
Most of them, yes, very much treatable.
Completely, or you just manage it?
Oh no, completely.
Completely
yes. Especially
treatable.
the infective causes.
Okay.
Yes. So if it's a bacterial, we have the antibacterial medications.
Okay.
We have the antifungal medications, antiviral medications. So depending on the cause, they can treat. It's just the other causes, maybe sometimes it might be associated with cancer, it might be associated with like medications that the person is taking to treat certain illnesses.
That can cause the meningitis.
Yes, so those might be a bit tricky. Yeah, and what I mentioned, the amoebic meningitis, that one is also, it's quite rare, but it's also quite deadly. That one has a very high mortality rate. And that is usually gotten from swimming in infected waters.
Hey, me, I like swimming, pal.
just make sure when you are swimming.
Or it's you're talking about like natural waters, like the lakes
usually,
and sea.
Yes,
me, I do the pool.
Rivers.
I do the pool. Okay, so let's quickly look. You've mentioned the treatment options, that it's based on the type of meningitis.
Yes.
So if it's bacterial, you are treating with the bacterial drugs and all that.
Yeah.
Okay, so we want to look at how long does the treatment process last. If somebody has been diagnosed with meningitis, is it that you're going to take maybe a week or two, a month?
It really depends on the kind of infection and the state of the patient. If the person is already immunocompromised, it might take longer. Yes, usually about a week to 2 weeks. Hospital stay should probably be like a week or so, and then the person should be fully recovered.
Okay.
Yeah, but depends on the person's condition as at the time it's diagnosed.
The person is diagnosed.
Yeah.
Okay. So is there ever a case where the person is diagnosed too late, nothing can be done about it, or there's always something that can be done about it?
Yes. So there's always something that can be done to prevent death. But if maybe you've had some brain damage and things like that, probably we can't reverse the brain damage. Yes, but yes, we can save the life.
And you can completely eradicate the infection.
The causative organism, we can get rid of it. Yes.
Okay. So we want to know, is there any vaccine available? Sometimes some of these things you can get vaccinated to prevent it. Is that the same for meningitis?
Yes. You see, because of the different causes, even some of the vaccinations that are given to the children, yes, we have some viruses that are being vaccinated against. They can also cause meningitis. Yes,
the vaccine itself causes?
No, as in those viruses cause. So we have.
Oh, okay. You are vaccinating against those viruses.
The children, yes. So that's even part of the vaccination against meningitis. So the measles, mumps, rubella, those can also cause a meningitis. So once you vaccinate the child, you are protecting the child from getting those kinds of viral meningitis. But when it comes to the bacterial meningitis, which is usually within the dry season, that's when the outbreaks occur. They do mass vaccinations as and when the outbreaks occurs.
Okay, for only children or for both children and adults?
Children and adults in the endemic areas, usually in the north.
Okay. Yeah. I want to know, why is it usually in the north? If you can briefly, I know our time, but if you can briefly just...
It's because of the weather, because it's very dry up there, and then the season...
They experience a longer dry season.
Yes, more or less.
Okay.
Yes.
And then finally, we in just about 1 minute, want to look at the preventive measures. What someone can do to make sure that I'm not getting this meningitis disease.
Yes, so hand washing is very important because of the droplet infection. Make sure you wash your hands all the time. when you are touching things and all that. You have to avoid when someone has an infectious disease, especially if you think they have a meningitis. You have to don't stay in close quarters with them where the ventilation is not good. Don't share cups and cutlery
personal
and those kind of
and
things.
all those
Yes.
things.
If you do have the condition, you have to avoid going to work and going out to spread the condition.
So basically, you need to isolate yourself
Yes.
until you are done with your
Yes,
treatment.
Yes. So, and you wear protective clothing, nose mask, and all those things. And if you are working with soil and those things, you have to protect yourself so that you don't pick up the infection from these places as well. Keep your food clean, wash your vegetables very well, and all that. And people who are taking medications or people who have weak immune systems should also talk to their doctors about what they are experiencing if they think they might be having the condition.
Okay. Thank you so much, Doc. This afternoon, we've been personally, I have been educated about meningitis. I used to think it was some strange thing because all the time we always hear, meningitis outbreak in the north, and I'm like, meningitis, what is it? But this afternoon, you've demystified it for us. Thank you so much for your time, and definitely, I know we'll see you next week.
Sure.